Morning, sir. So I will be discussing my proposal entitled Children's Disciplinary Action Towards the Awareness of Health Parental Discipline. So the current situation in our barangay, Talama, Davao City, is that all the children here do not wear face masks and while they're going to the computer shop in public places and so on. This is the main problem that I see in our barangay. That's why I am conducting this proposal to help our community. It is about the safety of everyone. However, while the world is eagerly waiting for COVID-19 vaccines to bring an end to the pandemic, wearing a mask to help prevent viral transmission has become more or less mandatory globally. Though many people embrace mask wearing and adhere to the public health advice, some rebel and argue that wearing a mask has been imposed upon them against their will. Some children have pushed back against mask wearing. This means that when told to wear a mask and socially distance, some people may perceive their behavioral freedom to be under threat. Anger and other negative emotions then follow. Disciplining a child involves establishing in them a sense of what is and is not acceptable behavioral. The intellectual ability of a child grows throughout a time. It is important to feed your child discipline to his or her understanding capacity. Just like, for example, a baby. A baby has no understanding what is good and wrong. Try to explain things to your child in a way that correspond to their developmental phase. And remember to bring yourself down to their physical level as well. Children use their behavior to express their feelings. So it is essential to understand what's going on inside their heads. You can assist your child in addressing the underlying issues if you understand the causes for his or her behavioral feelings. I have 3 goals in my proposal. First is to use techniques that encourage your child's sense of responsibility, to nurture self-esteem, and to strengthen your relationship with your child. The findings which the study reveals may benefit certain groups, and the benefits they may be able to be gained as follows. To the people of the community to prove that they will discipline their children with regard of the safety nets. To the barangay officials to remind all the computer shops and every family to be aware of the health protocol. As a result, their children or any residents in our community may know the health protocol and to maintain the safety of an individual. The description of the project is we need to conduct a meeting for all, also the barangay officials to support us and to be aware and to understand the health protocol. Then we inform the computer shop to limit only the gamers so that they maintain a health protocol. By giving these tablets and face masks to make sure that every children will have to access their online classes and online games. Because of that, they will be no longer to go to the computer shop. It is the main reason why we are submitting this proposal to the children that cannot access the internet. As we see in our community, some children will go to the computer shop to take their online classes and some of them want to play online games and not wearing a mask. This can affect the owner of the shop because they didn't obey the protocol. Also, their parents did not discipline their children to be aware of what was happening in the society. Calculating my budget, I make a pie graph and includes 4 parts. So, tablets and face masks, housing, miscellaneous, and debts. In tablets and face masks, I will give 8.2%, which is equivalent of 416,170 pesos. In housing, because in our community has a moderate or as a big community, I will give a 3.2, which is equivalent of 162,410 pesos. In miscellaneous is 1.4, equivalent of 71,050 pesos. And debts in 1.2%, which is equivalent of 60,900, with a total of 710,530 pesos. Science and technology application. As the use of technology in organization becomes more prevalent, good services and provided, more productive studies are being conducted, and as a result, more high-quality products are introduced. In addition, technology has become an indispensable element of life, serving as a focal point of attention in all aspects of life. Face masks can prevent the dispersal of droplets which infected people like talk, sing, cough, or sneeze. In reality, usage by each individual varies. The mask may not only fully cover the mouth and nose, or it may be used and reused too frequently. This can mean huge variation in mask performance outcomes. In addition, wearers should avoid touching in their faces and the external surfaces of their mask. Hand hygiene also varies from person to person. Hence, mask usage must be complemented by other behavioral changes for effective infection prevention. Moreover, with the project we are conducting by giving face masks to each household, it shows that we can help reduce the spread of infection and save lives. It's much harder to make a compelling case against wearing a mask. As well as giving tablets, they are able to stay home and not go outside to any public places. For instance, computer shops. The fewer people around, the lower your chance of infection. When you stay at home, you will stop the spread of the others. We are trying to help individuals to stay out of crowded places. Thank you.